All right. Hi, everybody. Welcome to Texas Children's Periscope session on the Zika virus. We are thrilled to have Dr. Christy Murray and Dr. Darcy Aagaard join us today. So let's start by learning a little bit about our experts. Dr. Aagaard is the Vice Chair of Obstetrics and Gynecology at Texas Children's Pavilion for Women. Dr. Aagaard, can you tell us a little bit more about yourself?
So I'll start with the friendly stuff. So I'm a mother of 5, ranging from 15 to 22 years old, and we are a 2 Texas Children's Hospital faculty family. And so my husband is Dr. Jim Versalovic, who's been working on the Zika virus testing. And we have a passionate interest in understanding potential acquired complications that women experience in their pregnancies and preterm birth, and we work on congenital anomalies.
Excellent, thank you. Dr. Murray is the Associate Professor of Pediatric Tropical Medicine.
A native Houstonian, 5th generation, which is unheard of here. I am not as much of an overachiever as you. I only have 3 children, ranging from 4 years old to 14, almost 15 years old now. And I've been here at Baylor College of Medicine for the last 4 years. Prior to that, I was at University of Texas and spent many years at the Centers for Disease Control and Prevention as a true virus hunter. So that's my background.
Awesome, thank you. So with all of the news stories making headlines, we wanted to take some time to answer some of the most commonly asked questions surrounding Zika. We hope everyone can leave today's Periscope session feeling informed. So if you have any questions throughout the session, we'll do our best to answer them at the end. So jumping right in, let's get started with what is Zika?
So Zika virus is a certain type of virus that really is only transmitted normally between mosquitoes and people. So mosquitoes are part of the virus when they take a blood meal, and the virus replicates within the mosquito, and then when the mosquito goes on to feed on another person, the person becomes infected with the virus. The virus normally is one that doesn't cause much in terms of symptoms. About 80% of people won't even know that they're infected. About 20% will have just a mild viral looking illness. Chances of them actually getting tested for Zika or their doctor suspecting Zika would be very low. So it's a very mild illness normally with this infection. Now we have seen other ways that the virus has been transmitted, but typically we think of this as a mosquito-borne virus.
Okay, awesome. Do you want to speak a little bit more to how it's spread?
So the mosquito that carries the virus is one that's predominantly a human feeder, and it actually breeds just around people's houses. It loves artificial containers, and so it'll breed in those containers, and you'll have a lot of mosquitoes within. The way the mosquito is it is one that you don't really notice much. They love feeding down at the ankles or behind the neck, places where we don't normally think of mosquitoes, and a little bit harder places to swat. In many of the areas where we see this explosion of cases of Zika virus, it's in countries where they just don't have air conditioning, they don't have screens on their windows, so there's a lot of access between the mosquitoes and the human population. People become infected, they get very high levels of virus circulating in the blood, and then that's what infects the mosquito, and they can have those high levels for about a week for those mosquitoes to become infected. And so the mosquitoes are carrying the virus, the people are carrying the virus, and that's how it's spreading.
Okay. And then there's some unusual things that we're starting to learn about Zika virus that has surprised us a little bit. So when we compare it to these other flaviviruses that we know something about, there's a couple things that started to pop up when we had very, very large populations affected by Zika virus. And we'll talk about one of those in a minute with respect to microcephaly. But one of, I think, the first earliest things to appreciate is Zika virus has been around since the 1940s. It was first detected in Uganda, and it's really made a eastward transmission, and now it's actually circled the globe entirely. It's pretty much stayed more on the southern end of the globe, but it started out in Africa, it spread out through Polynesia, and then came on and arrived in Brazil just about 18 months ago now. And most of the outbreaks of Zika virus, the biggest one before the current one throughout South and Central America was in French Polynesia, and there only about 28,000 or so people were infected. And so we haven't noticed as much about Zika virus, but when we look back at that French Polynesian outbreak, it developed something called Guillain-Barré, which is when they have neurologic symptoms, and they can have muscle weakness, difficulty lifting their arms, walking, and sometimes it can progress till they have difficulty breathing. There were also a case report where 2 patients from the French Polynesian outbreak did have what we call perinatal transmission, which means it was transmitted through a mosquito bite on the mom, and eventually when the baby was born was noticed to have Zika virus in the placenta and the blood. So while it's normally transmitted through mosquitoes, there's something a little bit special about Zika, that it can be transmitted in 2 other human situations. So the first one I mentioned, which is what we call vertical transmission, or mom to baby. We also know it can be transmitted sexually. There's 2 good case reports. One is many years old and one is more current, where it was transmitted from a sick male partner to his female partner. So the male partners in both those situations were known to have traveled outside of the US. They came back, they were acutely ill, and they did then sexually transmit to their female partner who had not traveled. So there's some caveats around how it's spread, and we're still honestly learning a lot more about that. That's why we're being very, very cautious with our blood supply, and we've taken a hard stop here in the Houston area about if you've traveled, your partner has traveled, we're going to ask you about it, and ask that if you've traveled to endemic regions, you not donate blood because of this concern of person-to-person transmission. As far as we know, it's limited in terms of that vertical transmission and sexual transmission, but we have more to learn about that.
What's diagnosed? Any signs or symptoms?
You want me to do signs, symptoms?
You go for signs and symptoms, I'll do diagnosis.
Okay.
Perfect.
Again, like I said before, this is a virus that normally doesn't create a lot of disease in the people who are sick. So when we talk about people having actual symptoms, it's usually a fever, a rash, just not feeling well, maybe some joint pain, body pains. But that's about it. Really, we don't see much other signs, maybe some redness in the eyes, and that's about all we'll see. And again, that's only 20% of patients. About 80% of people will have no symptoms at all, but they still do have virus in them, and they are still replicating virus, and so they can get high levels of virus in the blood.
So this creates a really tricky situation, especially when we're dealing with pregnant women. So if only 1 in 4 or 1 in 5 have symptoms, but it's possible that 4 out of 5 have been exposed, we can't rely upon clinical symptoms as our way to diagnose Zika virus. And that's for 2 reasons. One is, as we've said, not everyone will be clinically symptomatic. And the second is, even when they do have symptoms, one of the tricky things about Zika virus is it tends to travel with 2 other viruses that live in those same female mosquitoes, and those are chikungunya and dengue. So they all kind of present in similar ways. So we have to figure out who's got what. And that's been one of the big challenges about Zika, because not only do we have to figure out, is somebody potentially infected but is not sick, or is somebody who's sick not actually infected with Zika virus? So to date, we rely upon what's called serology. So whenever we're exposed to a bacteria or virus, or we get a vaccine, we mount an immune response to it. And the antibody, and I always call it a sticky finger antibody. So it's got multiple arms. It's got 2 5-pronged arms, so you can literally take your hands and think about an IgM molecule. So that IgM antibody is very sticky, and it will actually stick to all 3 of those viruses. In fact, it'll stick to almost any flavivirus. And so when we do that IgM test, it is not real good at telling us specifically, have you been infected with Zika virus? And again, because Zika virus travels with dengue and chikungunya and some other things, we don't really know. Are they making an IgM antibody because they really got infected with Zika, or could it have been something else that they got infected with? So that's where Right now, we send things on to the CDC, and they do what's called a neutralization titer, which means if we take less and less and less of somebody's blood, can we get more and more and more specific for Zika? And it's kind of a substitute for doing a much, much tighter, non-sticky hand antibody test called an IgG. So we don't have that IgG yet for Zika, so we have to do this neutralization titer. So that's telling us whether somebody has mounted an immune response to the Zika virus. Now, especially when we're dealing with things that involve mom to baby transmission, that gets a little complicated because babies don't really make immune responses the same way when their fetus is in utero. So we have to have ways of rapidly diagnosing for the virus itself. That's called the quick test or the rapid test, but is a test where we're actually taking bits of matched up RNA to the Zika virus RNA, and we're making many, many copies from one of that Zika virus RNA test, PCR test. And that's really important for us to have when we're trying to figure out, for example, has Zika virus actually been transmitted to the womb? So if we go in and do an amniocentesis and we take fluid from around the fetus, we're not looking for those antibodies. We're not asking, did that baby make an antibody response to Zika? We're actually trying to pick up the Zika virus itself. That's also important because it takes a little bit of time for our immune system to respond to viruses. And so sometimes in a very acute phase, when somebody's really sick, we need that rapid test. And so that PCR test comes into play there.
Okay, awesome. So the next question I have is, what are the speculated effects of contracting Zika during pregnancy?
So this is a really tricky question to answer, and so I'm going to answer it in two ways. Stories started emerging in the news, and we have so much thanks to give to those really astute clinicians out in Brazil who generally a mom, daughter, son group of pediatric neurologists down in Brazil that started to notice they were seeing more microcephaly or small babies' heads than they typically had seen in their many, many years in practice. And this was in the northern states of Brazil. So that's what we think is a possible association is between Zika virus and microcephaly or small head. But it's not just microcephaly. It's that there are also some changes that go on in the brain with some malformations in the brain where the normal ventricles get larger than they should be and the brain doesn't develop the way it should. There's also been reports of associations with ophthalmic ulcers or ulcers in the eye where it appears the Zika virus may have degraded a portion of the cornea of the eye. The virus may be getting into the baby's central nervous system and causing these changes. That's a very, very difficult thing to prove. And what's been batted around is there are other potential explanations as to what could be causing microcephaly. Because right now all we know is that where there's been a lot of cases of locally transmitted Zika virus in Brazil, there's been an upswing in microcephaly. But that doesn't equal cause and effect, and it gets a little bit complicated for good reason, because just because two things occur at the same time doesn't mean that there's a cause. So they've tried to find other ways to figure this out. There have been very good documented cases of fetuses that have been affected, and we've been able to get the Zika virus back out of those affected fetuses. But again, that's an association and not causation. So when we're trying to kind of figure this out, one thing we can do is say, well, are there other cases where Zika virus looks like it's caused microcephaly? And that becomes even more tricky to try to figure out. As I mentioned, when we look at the French Polynesia outbreak, there were a couple cases of documented perinatal transmission, but we have to remember that human pregnancies are 40 weeks or 9 completed months. And if an outbreak is a shorter period of time in a smaller population, like 28,000 people, we may not pick up cases of microcephaly because there wouldn't have been enough people infected who were pregnant to actually bear out that risk. And we know not everyone who gets Zika virus during pregnancy turns out to have an affected fetus. So there's been a case described in the public literature around a set of twins where one twin's affected and another is not. So we don't understand, probably because now you're talking about, as of December, there were probably about 1 million cases in Brazil of Zika virus exposure, give or take a couple 100,000. And now you would start to have enough pregnant women over a long enough period of time, because now we're talking about a 15-month outbreak of Zika virus spreading across 26 countries, that if that association were true, we might now notice it when we otherwise wouldn't have. We're still missing critical evidence truly connecting the two, and we honestly can't say today, even when we think about this 15 hours a day, whether that's a true association or not. In other words, is Zika virus causing microcephaly? We simply don't know. But whenever we have a strong enough association that affects a lot of people's lives in really tricky ways, you know, it's incumbent upon us to issue a warning and say, till we figure this out for sure, let's be cautious.
Right, and the thought was that with the virus having circulated as long as it has throughout Africa, probably the reason why it was never picked up there is because it's been there for so long and they have constant circulation of this virus. And so children would be more likely infected with the virus. They develop those antibodies, and so but if they were reinfected with the virus during pregnancy, it's not gonna, it wouldn't matter. They would have that protection.
Yeah, that's a really great point. Thanks, Christy.
Yeah, thanks. So is there anything else you wanted to add for our viewers on just microcephaly?
So how we even define microcephaly is a little bit of a tricky issue. So we've developed here at Texas Children's and Baylor College of Medicine some pretty strict rules based upon a 6,000 person analysis over what we consider truly small heads. So there are some of us that have bigger heads and some of us relax their definition of microcephaly just a little bit. And so we said we're going to be strict about it, and it's 3 standard deviations off the norm, which means you'd have to have, if you had 100 babies in a room, you'd have to be literally the 1 to 2 in 100 who had the smallest heads. So we're being pretty strict about that definition.
Okay, awesome, thank you. So the next question is, how can people protect themselves from Zika?
So it's a mosquito-borne virus. The best way to protect yourself is, of course, to prevent mosquito bites. And really, you know, I try to stress this isn't just about if you're traveling to an area right now where it's endemic. So if you're traveling throughout the Caribbean or throughout Central America, Mexico to Central America to South America, I think we should always be good at any point to protect ourselves from mosquitoes. We do have other viruses that circulate here in the United States. They can cause extreme disease in people, and so protecting yourself against bites is important here versus being somewhere else. This particular mosquito, again, likes to bite at areas where it's harder to swat. And so I always say having a really good repellent on board is important. I do a lot of work in Nicaragua, and truly when we get out during the day and we're about to head out, we completely spray ourselves down, usually with something that has a fairly good concentration of DEET in it. So your Deep Woods Off or other types of repellents that work well. If you are worried about becoming infected with Zika, of course, the PAHO website has all the countries and has a current situation report of what's going on. But pretty much in any of these tropical regions, it's important to just prevent mosquito bites. And like you said, dengue, chikungunya, there are plenty of other mosquito-borne viruses circulating too. But really it's going to be through protecting yourself against mosquitoes. Now there has been documented transmission as well of sexual transmission. And so if you have a partner who's traveled to an area yourself during that time period, probably up to 30 days after return, because again, the partner might not necessarily have symptoms of disease, but they could still transmit the virus on.
And we know for sure that we can find traces of the virus with its RNA in semen, and we can find some in saliva. So we recommend that if your partner has traveled, and especially if you're pregnant, that you need to use condoms or abstain.
Okay. So the next question is, who should get tested for Zika?
Maybe that one is the clinician.
So who should get tested for Zika? So we like to kind of break that down into 2 different categories. One is pregnant women, and then everyone else. And so in terms of everyone else, the question we're asking with everyone else is, why are you sick? So if somebody comes and they're sick, we need to know, why are you sick? And so we're going to work through that based upon their travel history and where we're noticing that Zika has emerged. And so that's going to be a really good one-on-one relationship question with your physician to answer. The issue around pregnant women gets a little bit trickier. So as we talked about, only 1 in 4, 1 in 5 people who are infected will show symptoms. And we don't know whether or not people who have no symptoms have a higher or lower rate of transmission to the fetus versus people who do have symptoms. So we have to test everyone in pregnancy. And so what we're doing is looking at both whether or not a pregnant woman has made that sticky finger antibody response to the Zika virus, as well as testing with the quick test for actual Zika virus in those pregnant women. So we're asking questions around, have you potentially been exposed to the Zika virus?
Okay, awesome. So would you like to speak a little bit more about the test for Zika?
Which we kind of did.
Yeah.
So either you're going to look at antibodies, but typically if a person within a week after becoming infected, you can find very high levels of virus in the blood. So typically then you look at PCR, the quick test that you're talking about. From about 5 days following infection on to weeks, months, years later, then you can look at antibody response to infection. So it really depends upon where you are in terms of the stage of infection. And again, the ideal method is actually the quick test, because then it's very specific. You know exactly that is Zika virus.
And how good that quick test will be depends upon when you were potentially exposed. And right now, in this part of the world, we can really ask those questions around travel history or partners' travel history. But what we don't know is what's going to happen if the virus starts to move north up into Houston, because then it's going to get even more difficult. And we may end up expanding out our testing, especially by the quick test, in very different ways, because we're not going to know whether people are being reinfected or not. We don't know the answer to that question yet.
And to follow up, we do have the mosquitoes here that can transmit the virus, and we're getting close to the summer months where this is actually going to be a real issue, especially if people are traveling and they're not sick. We've talked about the possibility of getting those messages out to travelers that when they are coming back, to protect themselves from mosquito bites for 30 days after they return, just to hopefully not allow our mosquito populations to become infected.
So one of the last questions that we have is, if a woman is not currently pregnant but planning for a baby in the next year or two, should she monitor for Zika or take other precautionary steps? So
this is where we love to be specialists in maternal fetal medicine and obstetrics, because we get to give all kinds of advice about how to prepare to be a parent. And so we're going to do all the good stuff and say, well, you're going to optimize your nutrition and your health, and if you smoke or do other things, you're going to cut that out of your life, and encourage your partner to do the same thing. Around the specific Zika virus question, we don't know. We have no idea how long it can live in the blood and potentially infect a pregnancy or not. And while certainly people have said, well, it may be reasonable to think that in general, humans aren't going to be chronic carriers because they tend not to be of flaviviruses, Zika's already proven us wrong compared to other flaviviruses a couple of times. So what I tell women right now who've asked me that question is, if you or your partner are traveling, take precautions against mosquito bites. If you live in an area where the Aedes mosquito lives, which is us here in Houston, take precautions against mosquito bites. Should you put so much of your life on hold, like decisions around having a child, because of a concern about a mosquito bite? That's an individual decision somebody has to make, but I'm not sure that would be the number one consideration I'd have in terms of having a child. But that's just a mom of 5 talking. There are a lot more important considerations than that. So we simply don't know. We think it's probably safe after a month or 2. It's proven us wrong thus far, and it may prove us wrong again.
Awesome. Great. So do you guys have any final statements for our viewers?
I think the one thing that we're learning all the time is that there are new diseases emerging, and with what's happened with Zika, I think it shows how medical research has to just constantly stay on the ball to diagnose. I mean, I think it's amazing that people were able to identify Zika in an area where you have chikungunya and dengue circulating, because normally who would have tested even or thought to test for Zika? I think that's actually a really amazing outcome that has happened, because I don't think otherwise this would have been picked up. I think they would have, because the symptoms are very similar to these other mosquito-borne viruses. You know, there's a lot of work being done right now with trying to develop a vaccine, but a vaccine's going to be a few years away. There's, I think, a big rush right now to try and better understand the link between infection and microcephaly, as well as other potential outcomes. And so, you know, it's nice that we have the infrastructure in place to do those types of studies. So hopefully within the next year or 2, we're going to have a lot more information that's going to help us make better decisions too.
And I would just say, you know, out of any challenging situation in medicine, there's something good that comes of it. And I think, you know, what we're seeing with Zika virus is we get a lot of people who care a lot about other corners of the world. And they come together and they put their minds in one room and they say, gosh, is there not a way we can help figure out what's going on here so we can prevent literally heartbreak for the next 60 or 70 years in a family who would have a baby born with brain malformations and microcephaly. And that's, you know, and other things here at Texas Children's and Baylor College of Medicine. You know, as this story started to break over Christmas time, we formed a task force right off the bat to come up with clinical guidelines and figure out where we're going to refer patients. We've seen the first hospital-based test come forward in this rapid test, and that's when things really happen for the best. And so I think there are a lot of good minds and good hearts hard at work in figuring this out. We're kind of a hub of a lot of that activity because of Dr. Hotez and Dr. Murray and many others who spend their lives hunting viruses. And we're, you know, fortunate to have folks working hard to figure this out and getting those important answers that we don't have right now. We would say in general, don't panic. Take this with a grain of salt. But be wary and protect yourself against mosquito bites for lots of reasons.
Okay. Well, that's all of our questions for the day. Thank you to everyone who joined us. As always, check for updates on our next Periscope session on our Facebook page or Twitter account. And thank you both for joining us.
You're welcome. Our pleasure.
Thank you.
Awesome.